Pop quiz. A nurse is teaching a client who's been prescribed Lisinopril for hypertension. Which of the following client statements indicates the need for further teaching? A, I'll avoid salt substitutes. B, I may develop a dry cough while on this medication. C, I'll rise slowly from a sitting position. And D, I can stop taking this medication once my blood pressure is normal. Okay, so obviously, guys, the response that requires further teaching is D, because that's wrong. You're not going to just stop taking your medication once your blood pressure is normal, because what do you think is going to happen once you stop, right? So that requires further teaching. But I want to talk to you guys about the wrong answer choices. They're wrong because they're right. They're wrong because these are things that are correct, and we were looking for the wrong answer choices. A, I will avoid salt substitutes. Let's talk about this drug, Lisinopril. Lisinopril is, what is Lisinopril? It's an ACE inhibitor. I've told this story a million times. A way to remember this: when I was in nursing school, I had an arch nemesis, and her name was April. And she was my arch nemesis because she always aced her exams, and I always aced my exams. So it was always a competition who would get the higher A, right? And so I would always remember the drugs that end in pril reminded me of her, April, and she always aced her exams, ACE inhibitors, okay? So the drugs that end in pril, ACE inhibitors. Anyway, the ACE inhibitors, what happens is that class of antihypertensive agent, it decreases the secretion of potassium. So that by itself already places you at risk for hyperkalemia. And then on top of that, guess what the salt substitutes do? It's going to put you at risk for hyperkalemia. Why? Because salt substitutes are full of potassium. Okay, remember, potassium has a very narrow therapeutic range, 3.5 to 5. That is it. Anything outside of that range, you're dealing with cardiac dysrhythmias, right? So that client saying, I will avoid salt substitutes, that's wonderful. That doesn't require further teaching. They need to avoid salt substitutes, especially if they're taking an ACE inhibitor. So that's why we didn't choose that. Next, I may develop a dry cough while on this medication. That class of antihypertensive agent that can cause a cough because of the buildup of bradykinin. And here's the thing. If the patient develops a cough, you have to tell them this. If you develop a cough, let us know. Why? The healthcare provider is going to change the medication. There are so many great drugs on the market. We don't want you to live with that cough. They'll just prescribe you something else, but it can cause a cough, and we need to know if it happens. So 2, that's good. That doesn't require further teaching. Although I would add, if you develop a cough, make sure you let us know. That's important nursing intervention. C, I will rise slowly from a sitting position. Well, of course, that's for every antihypertensive agent, not only ACE inhibitors. Anything that lowers your blood pressure, you're going to be concerned about orthostatic hypotension. So you're going to teach the patient to change position slowly. You're going to teach them how to dangle. Matter of fact, I'll do you one better. You better teach that patient to press the call light if they need to get up for any reason, so you can assist them so they don't fall.